A new effort to save lives appears to be working at Hennepin Healthcare. In Minnesota, about 1,200 people died in 2023 from an opioid overdose. With that, Hennepin Healthcare was one of the first in the country to start a new program.
Yeah, arming its paramedics with Suboxone, a drug that can help put opioid addicts on the road to recovery. And now the city of St. Paul is adding a similar program to its toolbox. Fox 9's Karen Scullin takes a look at how it works and its success.
At Hennepin Healthcare, when it comes to an opioid overdose, it's not just helping the patients survive. They can actually start treatment right here before they ever get to the hospital. Efforts to save lives are going on every hour of every day. And at Hennepin Healthcare, that means an opioid overdose doesn't end with a shot of Narcan, as paramedics now carry Suboxone, a possible first step toward recovery.
So we use this little container, and inside are the 2 tablets.
The 2 pills are the dose for one patient.
I've been on scenes with patients where the gravity of the situation starts to hit them, and they do want to start treatment.
A patient experiencing an opioid overdose gets Narcan to help them survive, but now if that patient is coherent, paramedics give them a choice to start treatment right then and there before the withdrawal symptoms are too much to bear.
Cravings are blunted, if not, mostly gone. They start to feel more normal, and they are able to make those choices to do things to get their housing situation firmed up, or get their job situation, or their kids, or whatever.
Success is measured in different ways. Maybe most important are those who got a second chance at truly living again. In the first year of the program, 12% of HCMC patients who took Suboxone before they got to the hospital used it for long-term treatment. That was 11 patients.
The highest incidence of death is within the first 24 to 48 hours. And so if we can help protect people in that most vulnerable period and then offer them options into treatment, I see that as a big win.
But it's not just for an overdose. Someone trying to quit opioids may also benefit.
It is an option now for people to call 911 and get that first dose, and then go to the emergency department and get their prescription for home, so that they don't necessarily have to schedule a specific date and time in clinic.
The pills are an at-home treatment and simply dissolve in a patient's mouth. According to Dr. Simpson, if there is a relapse, unlike methadone, the impact is minimal.
So if you're on Suboxone and somebody has a relapse, often what people say is they don't get enjoyment out of it. They don't get high.
No one says this makes it all easy, but it is a chance at a real future, and that can now start on the street.
So much of substance use goes, hand in hand with housing insecurity, food insecurity, with, mental health issues, with all those things sort of build on each other.
There are very few places across the country that are operating like Hennepin Healthcare when it comes to Suboxone. So they're really trying to get the word out and educate more people. That's why they're so excited St. Paul is now getting on board. They just want to help as many people as they can to get on the road to recovery. In Minneapolis, Karen Scullin, Fox 9.